Hello, I'm Dr. Catherine Harris. Today we're going to talk about something adults ask me about all the time, but rarely get straight answers on: what not to do in anal sex. If you want the experience to be safe, respectful, and genuinely pleasurable, it's not just about what to do, it's about the 7 things you absolutely shouldn't do. I'll explain why these mistakes happen, what they feel like in real life, and how to fix them with practical, judgment free steps. This is educational content for consenting adults. Nothing here replaces personalized medical care, and if you have a specific condition or concern, please speak with a clinician who knows your health history. Ready? Let's demystify this clearly and calmly. First, a quick, friendly primer on the body. The anus isn't designed for self lubrication. The anal canal includes 2 main rings of muscle: an outer sphincter you can consciously relax, and an inner sphincter you can't control. When either is startled or pushed too quickly, the body reflexively tightens and says no. That's why patience, preparation, and communication are the real secret techniques. Good experiences aren't about forcing the body to submit. They're about giving it reasons to trust. With that in mind, let's walk through the 7 most common mistakes. Mistake number 1: skipping consent and real communication. Too many people assume consent is a one-time yes or no. In reality, it's a living, ongoing conversation. What not to do: don't ask vaguely, don't pressure, don't spring it in the heat of the moment without a prior check-in, and don't treat a past yes as a permanent yes. If either partner feels rushed or cornered, the body often responds with tension, pain, and shutdown, not pleasure. The fix is simple and powerful. Talk first, touch later. Agree on boundaries, signals, and pacing when you're fully clothed and relaxed. Use a traffic light system: green for good, yellow for slow, adjust, red for stop now. Decide in advance what stop means: hands off, deep breaths, reset, and what slow looks like: more lube, smaller width, different angle, or more warm up. If you do nothing else from this video, do this. Bring consent out of the shadows and into plain language. The most confident, connected lovers communicate clearly and check in often. Mistake number 2: rushing the body and skipping warm up. The fastest way to turn a potentially great experience into a painful one is to hurry. What not to do: don't go straight to penetration, don't aim and shove, and don't treat anal sex like vaginal sex. Different anatomy, different mindset, different speed. The fix is progressive warm-up. Think small, slow, still. Start with external touch, gentle pressure around the outside, slow circles, and time for the nervous system to catch up. Breathing is a tool. Long exhales relax the pelvic floor better than any trick. If fingers are part of the warm-up, file nails smooth, use gloves if you like, and use generous lube. Start with one finger, then pause. The goal isn't motion, it's melting. Let the sphincter say yes by softening around what's already there. If it tightens, that's a cue to stop moving and wait, not a cue to push harder. If you want to use toys, think ladder, not leap. Begin with the smallest, flared base toy and only move up in size when the current one feels fully comfortable without strain. Time invested here is never wasted. It's exactly what prevents micro tears, soreness, and bad memories. Mistake number 3: using little or no lube, or the wrong kind. Because the anus doesn't self-lubricate, lube isn't optional. It's as essential as consent. What not to do: don't rely on spit. Don't assume a small amount is enough. Don't ignore reapplication. And don't use oil-based lube with latex condoms. It weakens latex. Also avoid numbing creams. They can mask pain, the body's protective signal, and raise the risk of injury. The fix is choosing and using lube intentionally. Water-based lube is versatile, condom-friendly, and easy to clean, but it can dry out, so reapply. Silicone-based lube is wonderfully long-lasting and very slick. It's also condom-friendly and great for anal play, though it can degrade certain silicone toys, so check manufacturer guidance. A practical rule of thumb: if the sensation shifts from glide to drag, Stop and add more lube. Keep lube within reach. Don't break the moment searching for it. If you learn the rhythm of reapplication, everything feels safer and better. Mistake number 4, poor preparation and harsh cleaning. Many people think a deep internal clean is necessary and go overboard. What not to do? Don't use strong soaps internally, don't do repeated or high-pressure douches, and don't feel you have to be perfectly empty to be worthy of pleasure. Aggressive cleaning can irritate the delicate mucosa, disrupt natural defenses, and make the experience more uncomfortable. The fix is simple, gentle prep. A normal shower for external hygiene is usually enough. If you want to feel extra confident, a small volume, body temperature rinse with plenty of time to fully expel can be okay. The key word is gentle. Never force fluid against resistance. Leave at least 45 to 60 minutes for your body to settle afterward, and stop if you feel cramping or urgency that doesn't resolve. Consider timing. Many people find it easier on an emptier stomach and several hours after a bowel movement. Avoid fiber overload right before and avoid laxatives for this purpose. If you have hemorrhoids, fissures, rectal bleeding, inflammatory bowel symptoms, recent surgery, or pain at baseline, postpone and speak with a clinician first. Preparation should feel kind, not punishing. If prep leaves you irritated, preparation itself has become the problem. Mistake number 5, ignoring barrier protection and cross-contamination. Anal sex carries risk for STI transmission, and the rectal mucosa is more prone to tiny tears that you can't see. What not to do? Don't skip condoms for penetration. Don't reuse the same condom between partners or between anal and vaginal oral sex. Don't move from anus to vagina without a brand new condom. That's a fast track for infections. And don't share toys without cleaning. The fix is barriers and reset points. Use condoms for penetration. Change them when switching body areas or partners. If you use toys, either place a condom over the toy and change it when switching, or wash the toy thoroughly with the right method for its material. Dental dams or cut-open condoms can reduce risk during oral-anal contact. If you or your partner are at higher risk, talk with a healthcare provider about comprehensive testing that includes rectal swabs when relevant. Many routine panels don't automatically include them. Medications like PrEP or PEP may be appropriate for some individuals. Only a clinician who knows your situation can advise you. Remember, barrier methods aren't a mood killer, they are a trust builder. Nothing says, "I care about you and me," like taking 5 seconds to change a condom when you switch from anal to vaginal play. Mistake number 6, unsafe toys, unsafe sizes, and unsafe angles. The rectum is not a storage shelf, it's a curved tube that can pull objects upward. What not to do? Don't use household objects as toys. Don't use toys without a flared base. Don't jump to large sizes because you saw them somewhere. And don't thrust straight forward at a steep angle. That can jam against tender tissue. Also, don't pull out quickly. The sphincter likes respectful exits. The fix is design and direction. Choose anal-safe toys with a wide base that can't disappear inside. If it's glass or metal, make sure it's purpose-built by a reputable brand. No improvising. Start small and respect your body's timeline. Angle matters. A slight forward curve that follows the natural path is more comfortable than a straight ram. Think slow arrival, slower departure. When removing anything, pause at the outer ring, let the body close down gently around the base, add a little more lube if needed, and breathe out as you lift away. If something does get stuck, don't keep fishing, which can push it further in. Seek medical care promptly. Clinicians see this more often than you'd imagine. And the sooner you go, the simpler and safer the solution. 7. Ignoring pain, red flags, and aftercare. The myth that pain is proof has hurt a lot of people. What not to do? Don't push through sharp pain. Don't ignore persistent bleeding. Don't continue if you feel dizzy or faint. And don't shrug off symptoms that linger beyond mild soreness. Don't mask pain with numbing products to keep going. That's how small problems become injuries. The fix is listening and caring. Pain that feels sharp, Stabbing or escalating means stop immediately. Gentle soreness can be normal after learning new sensations, but it should settle with rest. Seek medical advice if you notice significant bleeding, fever, persistent pain, or new swelling. Aftercare is more than a shower, it's a calm debrief. What felt good? What didn't? What would we change next time? It's a glass of water, a warm compress on tense muscles, and simple comfort like cuddling or quiet time. It's emotional reassurance that boundaries were honored and bodies were respected. Aftercare turns a single event into a positive memory. Without it, even technically successful encounters can feel shaky or unfinished. Now that we've covered the 7 don'ts, let's slow down and translate them into real-world flow. Imagine a calm, unrushed evening. You've already had a conversation earlier in the day, boundaries, signals, and a shared plan. You've set out your lube where you can reach it with one hand. You've chosen a small, flared-based toy as your first step, even if you've done this before, because you respect the body you're working with today, in this moment. You begin externally with relaxation and breath. No racing to the main event, because this is the main event. The body learning it's safe. You keep the dialogue open. How's that? Do you want me to pause? More pressure here or less? When it's time to progress, you add more lube than you think you need. You move in millimeters, not inches. You wait for acceptance, not force your way to it. You change condoms when switching acts. If something pinches, you treat that information like gold. Stop, breathe, add lube, reduce width, or change angle. At any point, stopping fully is a victory for trust, not a failure of passion. When you finish, you don't throw the moment away. You land it gently. You wash, hydrate, rest, and talk. That is how satisfying experiences are built, through dozens of small, wise choices. Let's dive a bit deeper into practical tips that support the 7 don'ts, starting with breath and the pelvic floor. The pelvic floor responds remarkably to the nervous system. If you breathe like you're bracing for a cold shower, short, clenched inhales, your sphincters often follow suit. If you breathe like you're letting tension drain out, long, audible exhales, your pelvic floor listens. Try this. On a slow exhale, imagine your sit bones widening and the tailbone uncurling. Visual imagery helps because the pelvic floor has a strong mind-body connection. Many people find that exhaling during the moment of initial insertion makes all the difference. Combine that with stillness. Pause, breathe, let the body welcome, then continue. Positioning can also make or break comfort. Choose positions that give the receptive partner control over depth and angle. Positions with forward flexion of the hips often help the outer sphincter soften. Some prefer lying on the side with a pillow between the knees. Some prefer on the stomach with a slight arch and support under the hips. Others like being on top to manage depth. There's no single right answer, but there is a right question. Which position helps your body feel safe? The correct position is the one that lets you communicate easily, rest if needed, and adjust without strain. Hands matter more than people think. Fingernails should be smooth. Jagged edges cause microabrasions that can sting for days. If gloves help you feel more hygienic and confident, use them. Nitrile or latex, keeping in mind latex allergies. Gloves also make cleanup simpler and can be swapped quickly between acts, which supports the no cross-contamination rule. If you're using fingers, keep movement small and patient. That outer ring will do better with gentle, steady pressure than with poking or drilling. Think of softening rather than penetrating. Let's talk about timing and the day you choose. Trying something new at the end of a stressful day, after a large meal, or when you feel rushed is an invitation for your nervous system to say no. Pick a time when you can be present, unhurried, and kind to your body. If you're experimenting after a period of constipation, wait until your bowel habits are calm again. If you're flaring with hemorrhoids or recovering from a fissure, wait and heal. Part of maturity in sexuality is knowing that waiting is a form of care, not a failure. A word about expectations shaped by the internet. Bodies on camera are curated, edited, and often numbed, coached, or trained far beyond what's shown. What not to do is compare your real body to fantasy choreography, then blame yourself when real tissue says, not like that. Your body isn't broken for needing more time, more lube, or more gentleness. That's what human bodies need. Pleasure that's sustainable is always compatible with health. If an approach requires you to override pain or ignore your instincts, it's not the approach for you. If you're curious about training your body for more comfortable anal play over time, think in weeks, not minutes. A gradual, structured routine can help. Once or twice a week, using a small plug for short sessions focused on relaxation, not endurance. The goal isn't to graduate to the biggest size. The goal is to teach the nervous system that this sensation is safe and sometimes pleasurable. Keep sessions short, end on a good note, and don't push through tightness that doesn't release with breath and time. If your body says not today, respect it. Your next session will be better for it. Hydration and lubrication go hand in hand. Dehydration can make tissues feel more sensitive and less forgiving. No need to chug. Just be normally hydrated, the way you are before a workout or a long walk. Avoid excessive alcohol or recreational substances as shortcuts for nerves. They impair judgment, dull pain signals you need to hear, and increase the risk of injury or boundary violations. A clear mind is the best safety tool you own. Now, because you asked for the 7 most common mistakes, let's crystallize them once more, this time with a quick, don't try instead format so you can internalize them. Don't assume consent once. Try instead to create a continuous consent culture with agreed signals and frequent check-ins. Don't rush the sphincters. Try instead to warm up externally, breathe out during initial entry, and move in millimeters. Don't skimp on lube or use the wrong kind. Try instead to choose a condom-compatible, anal-friendly lube and reapply generously. Don't overclean or use harsh products. Try instead to keep hygiene gentle and allow time for your body to settle after any rinse. Don't skip barriers or mix body areas with the same condom. Try instead to change condoms between acts and use dams or toy covers as needed. Don't use unsafe toys or leap to large sizes. Try instead to use flared base, purpose-built toys and progress patiently. Don't push through pain or skip aftercare. Try instead to stop at sharp pain, watch for red flags, and end with physical and emotional care. Let's also address common questions I hear in clinic. Is pain ever normal? Discomfort can happen when you're learning, but sharp pain is a no. Listen to it. Is lube really that important? Yes. In anal sex, lube is the difference between glide and grind. Choose glide. What about numbing creams? I don't recommend them for this use. They silence essential warning signals and can set you up for injury. Do I have to douche? No, many people don't. If you choose to, think minimal and gentle. What if something bleeds? A tiny streak can occur with irritation, but significant or persistent bleeding needs medical attention. Can I go from anal to vaginal? Not with the same condom or without washing thoroughly. Always reset to prevent infections. If you're the partner giving penetration, your mindset matters as much as your technique. You are not the driver of a vehicle. You are the guest of a body. That means your pace is the body's pace. Your measure of success isn't depth or speed. It's comfort and connection. Ask more questions than you think you need to. Praise the process, not the goal. Catch tension early and celebrate adjustments. Do not be offended by stop. Stop is the greatest trust someone can place in you. If you're the partner receiving penetration, your role is not to endure. It's to lead. You get to set the speed limit, and you are allowed to change it without apology. You are allowed to say, not tonight, smaller, more lube, or let's switch to something else. Your body is wise. If it says pause, pause. You will not miss out on pleasure by respecting that wisdom. You'll build more of it. Let me close with a perspective shift. Many people think anal sex is either a daring stunt or a forbidden zone. It is neither. It's simply another form of adult intimacy that, like any other, rewards patience, information, and care. Mastery isn't doing more extreme things. Mastery is doing simple things with exceptional attention. Get consent right, and everything else becomes easier. Get pace right, and the body opens. Get lube right, and friction transforms into glide. Get hygiene and barriers right, and trust settles in. Get safety right, and pleasure stops being a gamble and becomes a skill. So, what not to do in anal sex? Don't treat it like a test you either pass or fail. Don't treat pain as a price you must pay. Don't pretend the body is a door you can force open. Instead, treat it as a conversation with nerves and muscles that respond beautifully to patience, clarity, and kindness. I'm Dr. Catherine Harris. If you found this helpful, share it with someone who could use clear, respectful guidance. Take what serves you, leave what doesn't, and always, always choose care over hurry. Your body will thank you, and so will your future experiences. And one last reminder before we part. If you have existing rectal pain, bleeding, inflammatory bowel symptoms, recent surgery, or you're unsure about your individual risk for infections, please consult a healthcare professional who can tailor advice to you. Education is a great beginning. Personalized care is where it becomes truly yours. Thank you for listening, and take good care.